You know, there are millions of Americans that deal with the pain of neuropathy on a daily basis, and it doesn't necessarily have to be tied to diabetes. Well, trying to get some good relief from that is very important. And that's why today we're at the Back and Neck Care Center on Pass Road in Biloxi with the offices of Dr. Vince Mitchell and one of his patients, Mr. Metz. How are you, sir? Nice to meet you. Tell us, how did you hear about Dr. Mitchell's office?
That's interesting. My wife had a back problem, excuse me, and a physician we know recommended chiropractic. And we came, and he recommended Dr. Mitchell. We came and saw him. He fixed her back, and I learned about treatment for neuropathy by Dr. Mitchell.
What type of symptoms were you experiencing before you came in here?
I had tingling and pain all over my legs and body. Sometimes, even when my clothes touched my skin, it would be painful. My toes would tingle all the time.
Now, and you don't have diabetes.
No, sir.
So this is something, you know, that you've had for how long?
For years, many years, and I was diagnosed with neuropathy by a neurologist. He gave me all the electrical tests.
So, I mean, what other type of treatments have you tried before you came here?
No physical treatments as Dr. Mitchell has done, but they were putting me on Pregabalin Lyrica, which...
you see those commercials all the time. It's like, oh.
And the side effects were not good, and I didn't like it.
Right, right. Because sometimes whenever you're taking medications like that, the side effects aren't worth, you know, the issues that you have to deal with them, as opposed to what you're dealing with neuropathy.
Yes, sir.
So you come to him for treatment, and how long have you been coming here now?
6 months.
6 months, okay. Things have gotten a lot better for you?
Absolutely.
Yeah?
My pain level has gone from 100% down to 30%.
Wow. That's quite an improvement.
Negligible.
Yeah.
It doesn't bother me. I don't think about it anymore, neuropathy.
So your quality of life has improved? You're able to get around a lot better?
Absolutely.
Yeah?
Happy.
Happier? I can look at your face and see that there's not pain there. Because a lot of times when somebody are dealing with things like this, you can look in their eyes or look at them and you can just see the pain. I mean, the eyes are the windows to the soul, as they say. And your eyes are pretty clear. So,
Thank you.
Would you recommend Dr. Mitchell to others?
I certainly would and have.
And you have. So you have been, as you said, went from 100% pain down to 30%.
Yes, sir.
All right.
And sometimes 0.
Wow.
And far as medicine goes, I'm down to minimal medicine.
That's the important thing.
And sometimes I just forget to take it at all, and I don't notice a difference.
That's a good thing. That's a good thing. Appreciate you, Mr. Metz. Appreciate you. And glad
Thank
you're
you,
doing
sir.
well. All right, let's talk to Dr. Mitchell and find out what he can do for you if you are dealing with the pains of neuropathy. Good to see you again, Dr. Mitchell.
Nice
as
to meet you,
always.
Jim. Thank you.
Mr. Metz, just amazing talking to him and the relief that he's gotten from coming to you for his neuropathy. And that's something that a lot of people deal with. And as mentioned with him, he didn't have diabetes. So people that, there's different people that can have neuropathy that don't have diabetes.
That's right. That's right. A lot of patients present to our office that don't have any type of symptoms of diabetic nerve pain. Okay, even though the doctors will put them on a gabapentin, Neurontin, Lyrica, that's kind of the cocktail that the medical professionals will put these patients on. And again, sometimes that'll help alleviate some of their pain. Problem is that they have to take more, and then next year they've got to take more, and that's been our experience, that these patients are actually overloading on this medication. The downfall of that is that this medication, long-term use, will cause them to start having balance issues. This is why they start walking with a cane initially, then they go to a walker, and then they will end up in a wheelchair. And it's a progressive degenerative disease.
And all the pills, I mean, they're really over a period of time, they're just masking the problem.
That's all
They're not healing
They're
it.
not healing, and that's the big thing. Is that again we try to educate. The definition of doctor is teacher. So we try to teach these patients how to get better. Number one, but there's really two things that we have to do for that patient. We have to give them fuel to that nerve, and we have to basically we've got to activate that nerve. So fuel means you can't go out and start eating pasta like it's going out of style.
Right.
You got to watch your carbohydrate intake.
Yeah.
There's some other metabolic things that you can do to help that out. Now, activating the nerve is doing things like doing oxygen therapy.
Okay, so this is a big oxygen tent kind of thing.
Yes, sir. This is the total brain and body. We get patients to, when we come in and do an evaluation, if we feel like we need to do oxygen therapy, we'll do what they call exercise with oxygen therapy, or EWOT. And we'll put them on a platform where we'll start helping them out with their balance, because we have noticed that a lot of patients who come in with neurological type issues, with balance issues, we'll put them on here to help them out with that balance. Then we force feed oxygen into them, because two things have got to go into that nerve. You've got to have glucose, and guess what else?
Oxygen.
Okay, to help that nerve repair. So this is why we do what we do. And this is
Wow.
really, and we've been doing it for I'd say, last 6-8 months.
Yeah.
We started incorporating that, and it's worked very, very well.
Yeah, I remember right before you moved over here to this new location here on Pass Road in Biloxi that you had it at the old location.
That's right.
And then you've got, I mean, your new office is absolutely beautiful.
We
It really
appreciate
is.
it. Thank you.
Let's talk about finding out if you qualify. You know, how can someone find out if they qualify for your treatment?
The first thing they can do is that they can call the office. They don't need a medical referral, okay, nothing of that sort. We're major providers for all insurance companies except Medicaid, and we don't take disability. However, patients can call the office. They can talk to Betty, or they can talk to Angela. Make an appointment, and for $89, patients can come in. They can talk to me. We'll do a full spinal evaluation. We'll do a neurological evaluation. We'll do any necessary x-rays for that $89. Now, the big thing is, the caveat is that if we accept you as a patient, we'll tell you. If we can't accept you as a patient, and if I find like your neuropathy is too far gone and there's no hope and we can't treat that kind of a neuropathy, I'll reimburse that $89 to you. And I have no problem doing it.
Did you fall and bump your head or something? That's amazing.
Yep.
That
Yeah,
you'll
it
give
is.
them if you can't help them, that you're going to give them their money back.
Yeah, that money is not that important to me. If I can't help it, why take it? So,
Wow. Well, as we can see with Mr. Metz, I mean, that was he got some tremendous relief
Yes, he did.
on
Yeah, he
getting
did.
that done.
He did.
So,
And he wasn't even prescribed to come in here for that. It was his medical doctor who told his wife to come in, and he found out he had neurological.
I know. And that was absolutely amazing.
Yep.
Dr. Mitchell, always great,
Appreciate
a
it.
pleasure.
You too.
And
You
just
too.
thank
Thanks,
you
Jim.
so much for the
You're-
wonderful work that you're
you're
doing to
welcome.
help people
We
out.
appreciate it. Thank you.
If you want some more information about it, again, you can go online. You can find out, on through Facebook, and then just call and make an appointment and find out if you can, get evaluated and help yourself or someone you love with the pain and neuropathy.